A patient with shock can look stable one moment and critically ill the next. Knowing which type of shock you're dealing with can be the difference between the right intervention and the wrong one. Today, we'll be looking at the different types of shock. Shock is a life-threatening condition that happens when there is inadequate tissue perfusion. Although each type of shock has a different cause, they all lead to the same dangerous outcome if not recognized and treated early. In this video, we'll break down the types of shock, what's happening physiologically, how they present clinically, and treatment commonly used for each. Let's start with hypovolemic shock. This type of shock is caused by loss of circulating volume, either from blood loss or fluid loss. Fluid loss may occur due to edema or ascites as well as severe dehydration. Blood loss may occur from trauma, internal bleeding or burns. Clinically, patients present with low blood pressure, tachycardia, decreased cardiac output and cool, clammy skin as the body tries to compensate through vasoconstriction. This vasoconstriction leads to an increase in systemic vascular resistance. Treatment focuses on restoring volume with large-bore IV access, fluids, and/or blood products when indicated. Common blood and fluid used include crystalloids such as normal saline or lactated ringers, colloids such as albumin and blood products such as plasma, packed red blood cells and platelets. Cardiogenic shock is a pump problem. In this case, the heart is unable to pump effectively to meet the needs of the body, even though volume may be adequate. This then causes a buildup of fluid in the lungs. Key signs include hypotension despite fluids, tachycardia, pulmonary edema, and crackles on auscultation, caused by fluid backing up into the lungs. Management focuses on oxygen, vasopressors or inotropes, and diuretics often used to reduce pulmonary congestion and decrease workload of the heart. Because the heart is failing, giving fluids does not significantly improve blood pressure and may worsen symptoms. Obstructive shock occurs when there is a physical blockage preventing the heart from filling or emptying properly. Even though the heart muscle itself may be functioning, blood flow is mechanically restricted, leading to a sudden drop in cardiac output. Common findings include jugular venous distension, hypotension, and tachycardia. This cluster of findings tells you that blood is not moving forward effectively, even though the heart may still be working. Treatment priorities include oxygen, supportive fluids, and most importantly, relieving the obstruction causing the shock. Distributive shock is different from the others because the issue is excessive vasodilation. Blood volume may be normal, but it is distributed too widely, leading to a drop in systemic vascular resistance and blood pressure. There are three types: septic, neurogenic, and anaphylactic. Septic shock is caused by a widespread infection that triggers a massive inflammatory response. Patients may initially have warm skin, followed by cool skin, along with hypotension, fever, increased respiratory rate and increases white blood cell count. Treatment includes aggressive fluids, broad-spectrum antibiotics, and vasopressors if hypotension persists. Neurogenic shock results from a loss of sympathetic tone, often due to spinal cord injury. Unlike other shock types, patients may present with bradycardia, along with warm, dry extremities and hypotension. Management includes spinal immobilization, fluids, vasopressors, and medications such as atropine to manage bradycardia. Anaphylactic shock is caused by a severe allergic reaction. It is characterized by hypotension, tachycardia, bronchoconstriction, and hives. The priority treatment is epinephrine, along with oxygen, antihistamines, and fluids. Now that we've gone through each type, let's look at shock as a whole. Shock is a state of inadequate tissue perfusion, meaning organs are not getting enough oxygenated blood. While the causes differ, the end result is the same: cellular hypoxia and organ failure if not corrected. Understanding the mechanism behind each type allows you to recognize shock early and choose the correct intervention. Remember, different causes, different treatments, but the same goal every time: restore perfusion and protect vital organs. This is how nurses think through shock.